Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 7 signs and symptoms of vitamin D deficiency. But before we do that, we need to understand the benefit of vitamin D to the body, and also we need to know what we should do if we have the deficiency. So vitamin D is one of the essential vitamins in the body. It's a fat-soluble vitamin, which means it's required fat to be absorbed in the body. And also the problem with fat-soluble vitamins that if you take excessive amount of those vitamins, your body will not flush it out. It will accumulate in your body. So when you take vitamins that fat soluble, we have to be accurate with the dosage so it will not cause toxicity in the system. So several important functions of the vitamin D. One of them is it reduces inflammation. And some of the signs and symptoms actually related to the inflammation. It's modulation, the process of cell growth. So you need it for the cell growth, for your nervous system, for your immune system to function properly. We need it for glucose metabolism. And it's also required for many function of our genes to help our cells to proliferate and also to differentiate and the apoptosis functionality of the cells. So apoptosis is the cell destruction, self-destruction. And in all of our cells has to die. And if the body cannot get rid of its own cells, it will be converted to carcinogenic cells. So that's very important, and that's an important function for the vitamin D. And also that is one of the signs that you might have vitamin D deficiency, that your cells does not really destroy themselves and they just continue overgrowing and converting to carcinogenic cells. The other function is it helps to absorb calcium in the stomach. So what are the signs and symptoms? So the first one that is very common, and a lot of you probably know, that vitamin D required for your immune system to function properly. So I'm gonna go over several studies that confirm those signs and symptoms to confirm what could be happening internally in the body when you have deficiency. So overwhelming evidence exists for the physiological role of vitamin D in the immune system. So it's actually correlated the existence between adverse immune outcomes like infections and autoimmune diseases and vitamin D deficiency. What that mean? That mean when your vitamin D is low, you have higher chance to be infected, to be sick, and also to have autoimmune diseases because your immune system is not working properly. And several studies, they actually confirm the same finding. So you're gonna be sick frequently. The second sign is arthritis. As we mentioned in the beginning, it helps to reduce inflammation. So if you have inflammation in the joint and you have D deficiency, that will make it worse. So the odds of vitamin D deficiency was increased for arthritis, muscle pain, and chronic widespread pain. So that's a meta-analysis, which means they reviewed several studies and confirmed that D deficiency increased the arthritis pain and the muscle pain. The third sign is fatigue. So vitamin D treatment significantly improve fatigue in otherwise healthy persons with D deficiency. So when you start to have a lot of these symptoms simultaneously, there's a higher chance you have vitamin D deficiency. But I want you to be aware that some of those symptoms overlap with other vitamins and mineral deficiency, and I will talk more about it at the end, what you should do to figure out which vitamins and minerals that you might have deficiency with. So the fourth sign is impaired wound healing. So when we look at this study, actually, the subject that actually had vitamin D their ulcers decrease the size from 25 to 18 square centimeters. So, and compared to the placebo group, their ulcers actually decrease from 27 to 24. So that's a significant decrease in the size of the wound. So the conclusion is actually vitamin D deficiency help with the wound healing. The other perspective for this study, if you have D deficiency, your wound will not heal properly and it will take forever. So the fifth sign and symptoms is osteopenia and osteoporosis. It is clear that vitamin D is essential, that's a study, for bone health with insufficient intake resulting not only in a classical deficiency disease of rickets and osteomalacia, which is actually softening of the bone, but it's also increase your risk of having fraction. So there's a lot of hype that calcium is the main reason for decreased bone density. But if you take calcium without looking at lab, there's very high chance you're overtaking calcium. And when you take too much calcium, it's going to cause issue with the D and the magnesium. And calcium links to a lot of health issue. Especially American diet has a lot of calcium compared to magnesium and D compared to our ancestors. So D is very relevant to decrease bone density, osteopenia, and osteoporosis. The sixth reason, and a lot of people do not even think about it, is it could cause depression. So in this study, they found depression was more prevalent in individuals who were diagnosed with vitamin D deficiency. Think about this way. You have arthritis, you have muscle pain, you are fatigued, your wound is not healing. Of course, you're going to be depressed. And the other thing is it's required for neuromuscular system to function properly. So if you don't have enough D, that will affect your mood too. So the last reason, and it's very personal to me because I am a cancer survivor twice, it's linked to several types of cancers. So D deficiency, there's overwhelming actually study shows D deficiency correlation with the calcium, with the cancer incidence. So there is well-documented association between vitamin D intake and the risk of, let's count how many cancer in this study that they looked at it. And they looked at several studies to come up with this conclusion. So breast cancer and low D also correlated to colorectal cancerogenic, and also prostate cancer and multiple myeloma. So to sum it up, if your D is low, your immune system is compromised. What that mean? That means you're not gonna fight viruses, bacteria, you will not be able to fight cancer. So you increasing your risk of cancer and having infections. Your vitamin D is low, you're going to be fatigued, you have muscle pain, you will be depressed. And also when your vitamin D low for extremely long time, you will start to see it in your bone. You will have bone density problem. And if you have wound, it will take forever to heal. The other problem is you're increasing your risk of having fractures because your bone is very fragile. So what should we do for vitamin D deficiency, or do you have it or not? If you have combination of a lot of these symptoms, that's a good indicative you probably have vitamin D deficiency. But I want you to be aware that in the body there's at least 13 vitamins, there's at least 16 minerals, over 50 hormones, and 40 neurotransmitters, and all of these has to work synergistically together to help your body to be healthy. And if you have a lot of these symptoms, some of these symptoms overlapping with several vitamins and minerals. So the best thing to do is to figure out which vitamins and minerals you might have issue with. D extremely common, it's prevalent for patients, especially if you're 65 years and older. This study shows it's 85% of those population actually has D deficiency. There's other study shows that for American, on average, 40 to 50% of American has D deficiency, even if you live in California or sunny areas. But if you're not exposed to the sun very often, you're not getting enough D, because the D from the diet is not enough. So what should we do if you have D deficiency? First thing, there's a lot of people go to the lab work. The problem with that is the range is very wide. So I look at the lab work, but there's a very narrow range, because if the doctor is not aware of the new studies, they will take the wide range of the lab by face value and will assume that you have a normal D level, but that is inaccurate interpretation, because the range should be smaller than the range that's in the lab. So if you want to take D supplement, you can take D supplements. There's several forms. One of them that's toxic, the other one is not toxic. You can take D3, but we need to know the dosage. Why? Because vitamin D, as I said, it's fat soluble. If you take too much of D, it's going to be toxic to your cells. So it's important to look at the lab to figure out how much D do you need. And you cannot take D by itself. You have to take other vitamins and minerals with it to deposit the calcium in the bone. And I will go over that in the other video, because if you take only D, that will help to absorb your calcium, but your calcium going to be everywhere in your body and will cause cardiovascular diseases, and actually could cause osteoporosis, because the calcium is high compared to other vitamins and mineral, and I will go over that in other videos. So dosage extremely important. The form extremely important, because some form of D that's synthetic, it's actually toxic to the cells and could actually increase your risk of cancer. So what should you do now? One of the simplest way you can do just actually right now is take advantage of Ask ASTR. It's a free online medical evaluation. It's askastr.com, and it takes about 5 minutes, and the questionnaire will help you and guide you through the process of if you have any possible vitamins, mineral deficiency or hormonal imbalance, and the software will guide you on what steps you should take to really meet that. And that's basically customizable way of look at your health and your symptoms, instead of just reading about one vitamins, one mineral, and assuming that's the only issue. Because the reality is, when you have vitamin deficiency, it's usually combination of vitamins and minerals that are deficient, because several vitamins and minerals depend on each other for absorption. So if you deficient in one of them, it's gonna cause imbalance in other ones. So we have to look at the whole picture in order to really get accurate answer on which vitamins and mineral and what is the dosage that you need to really meet those deficiency. Because, for example, if your body needs 100 milligram of D and you take 5 milligram of D, that's not enough to cause any physiological change. Even you have the deficiency and you're taking the right supplements, but you're not taking enough to help you with your symptoms and getting back to normal. So it's important to actually look at the dosage at the same time. So if you have any question or comment, leave it in the comment section below, and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.